Hi, this is Irvin from Resilience Occupational Therapy. I wanted to talk to you about tennis elbow. I introduced it and discussed what it was a little bit in the previous video. And discuss the use of the TheraBand Flex Bar. There are three basic colors, there's actually four, but the three ones that we'll talk about today of the TheraBand Flex Bar. The yellow is the least amount of resistance and the easiest to use. If you have really acute elbow pain, I recommend you see a therapist, but I also recommend starting with the yellow because that will not irritate your elbow as much when you go to use it. The red is the next step up where I start many of my clients, and the green is once you've really started using it. The blue is sort of the more advanced strengthening that by then you're not really feeling the pain, but it's more for maintenance. But in any case, today I'll demonstrate or in this video, I will demonstrate one of the two exercises to use with the TheraBand Flex Bar. So the whole idea is strengthening without injuring your elbow, your wrist extensors. Also does some elbow extension. And the idea is instead of actively strengthening by pushing the muscle into contraction, what we want is to do what's referred to as an eccentric contraction. So eccentric contraction means that the muscle that is working is actually going in the opposite direction than it normally would. So in any case, I want you to hold the band like this, or the flex bar, and if you have a little bit of a bend to your wrist when doing it, it will help it'll help increase your exercise, but you don't have to do that. Grip it and then extend your arms. The idea is that you're not twisting actively, but you're positioning yourself and then just holding that position. And then very slowly let off, like you're letting off the gas on a motorcycle, and bring down. And then come back, reposition each time, and come down. I typically recommend somebody do, depending on how much pain this causes, and really pain is not what we're looking for with this exercise, do 3 sets of 5 or 3 sets of 10, depending on what feels right for their body, and to do that once or twice a day. So again, grab it potentially at an angle so that your wrist is already flexed. Extend, and then extend your wrist like you're letting off on that gas. So there you have it. That is one of the two exercises on using the TheraBand Flex Bar to help with your lateral epicondylitis or tennis elbow. If you like this video or have any questions, please comment below and feel free to reach out to me directly.